My name is Mary Dion, and I'm acting as the hygienist, and this is Sheila, and she's acting as the patient. We are doing tobacco dependence education with a patient who is in the pre-contemplative stage of quitting tobacco use. Hi, Sheila.
Mary?
So I noticed you are a smoker.
Mm-hmm.
How long have you used tobacco?
Probably about 10 years.
Okay. And when you wake up in the morning, how long until you use tobacco?
It's usually, I don't know, not right when I wake up, but I don't know, probably half an hour or more.
Okay. And what do you use when you smoke?
Just cigarettes.
Okay. And how many cigarettes would you say you smoke per day?
Probably about 6.
Okay. Does the person closest to you use tobacco?
No, they don't.
Okay. And how interested are you in stopping your use of tobacco?
I'm not interested at all right now.
Okay. Have you ever discussed with your doctor about stopping your use of tobacco?
No.
No? Okay. If you decided to stop using tobacco right now or in the next 2 weeks, do you think that's something that you could do?
No.
No?
No, I don't think so.
Okay. So tobacco increases our risk for poor health and condition of the oral cavity. After your assessment, we discussed your discomfort with your bad breath related to your tobacco use.
Mm-hmm.
Do you think your desire for fresher breath may motivate you to perhaps consider quitting smoking?
Right now, not really.
No? Okay. So I do see that you're not ready to quit, but when you are, I'm happy to assist you in any way that I can, and I'd love to help you with your oral health concerns such as bad breath, if you're interested.
Okay.
As a tobacco user, do you think you could describe to me any risks you think might be associated with your habit?
Yeah, I mean, all the ones that you hear about, so lung cancer and just like staining on the teeth and all the normal ones that everyone talks about.
Okay. Can you identify perhaps any benefits related to quitting your tobacco use?
Yeah, I probably save a few bucks
Yeah.
from quitting, and I guess, like you said, probably have better breath, which would be nice.
Okay. So what do you think are some barriers related to your tobacco use and quitting?
I think it's just something I need right now. It helps me if I'm stressed out, and yeah, I guess those are the main ones.
Okay, Sheila, thank you for discussing your tobacco use with me. I know this is kind of a difficult subject to address. Would you be okay with me revisiting this topic of your tobacco use at your next appointment?
Sure.
Okay, thank you. We are doing tobacco dependence education, and the patient is now in the contemplative stage. Hi, Sheila.
Hey, Mary.
It's great to see you again.
Great to see you too.
So I see that you have considered the idea of quitting tobacco use.
Mm-hmm.
That's awesome. We could explore some of the barriers you said in your pre-contemplative stage to quitting tobacco use. What do you think are some of the roadblocks that might be associated with your new consideration?
I think just learning to, I guess, deal with the stresses in different ways, which I can always ask family for help and support. So
yeah, there's lots of resources out there for coping with stress in healthy ways, which I would love to help you with as well.
Yeah, that'd be great.
So I just wanted to let you know I have lots of pamphlets here and options with websites and helplines and information if you're interested. And do you think you're ready possibly to pick a date that you'd like to quit?
I don't think we're quite ready yet for a date, but I'll definitely look at the information and see what I can, yeah.
Okay, perfect. Well, we're definitely taking a step in the right direction. I'm so happy that you came to me, and I'm excited to help you with this journey.
Awesome, thank you.
You're welcome.